Depression is a very common illness in which people feel down, depressed and hopeless and take much less pleasure and interest in doing the normal things in life that they find interesting and pleasurable than they would do normally. And it goes on for more than 2 weeks, because we all have bad days when we feel a bit low, and if that goes on for a day or two, that's unfortunate, but it's life. Whereas if you have those feelings and they go on for more than 2 weeks, that's probably depression. I think we would tend to divide depression up into mild, moderate and severe, and mild depression is very common, and people can have mild depression and will often recover with some self-help measures that they can institute themselves over a couple of weeks. So it's very common in general practice to see someone who's depressed, and if you give them some simple measures to look after themselves, they will recover, and when they come back in a couple of weeks they're much, much better. Someone who's moderately depressed may recover with those measures or may need some help with under medication or talking treatment, whereas someone who's severely depressed almost certainly will need both medication and talking treatment to help them get better and help them stay better in the future. I think first of all, self-help is very important and applies to any sort of depression. Whether you've got mild, moderate or severe depression, you can help yourself, and there are common things to do that are very sensible. If you're smoking too much, don't smoke or try and reduce your smoking. Don't use alcohol as a drug, because it's a very bad drug and doesn't necessarily help your mood at all. So you ought to reduce your alcohol intake down to or below the recommended maximums of about 21 units a week for a man or about 14 units a week for a woman. And certainly you shouldn't be using street drugs to try and help yourself feel better. People can, for example, smoke cannabis thinking it will make them feel better, when in fact it usually tends to make depression worse and isn't a good idea at all. Eating plenty of fresh fruit and vegetables, eating well, will tend to make you feel better, and exercising is absolutely vital. Exercise is a really good way of feeling better about yourself, and it gets you out. In general practice, about 7 out of 10 people with depression actually come and see their GP with physical symptoms. They might have headaches, backache, tummy aches. They may have alterations in their appetite, be losing weight or gaining weight. They may have difficulty sleeping, and see that very much as a physical symptom rather than something that's at all psychological. Often other physical symptoms people can have can be loss of the normal physical appetites that we all have, like for food or for sex, and people can lose those completely and lose quite a lot of weight when they're depressed. If you're worried about whether you might be depressed or not, you could reflect on how you're doing at work, or whether you're maintaining your friendships or not. Are you bothering to ring up your friends, or are you waiting for them to ring you? Are you taking an interest in your family? When did you last do something really special with your kids? Often people who are depressed will do none of those things, and that's very sad. If someone hasn't responded to those self-help measures after a couple of weeks, if they're mildly depressed, or if they've got moderate depression, then the time comes that you need to have a discussion with your GP about active treatment. And there are two sorts of treatment. You can either have medication or talking treatment. And traditionally, medication was the main treatment that was available. It's easily available in the GP surgery. I just have to write a prescription and the patient can go off and start the treatment right away. Talking treatment used not to be available so widely, but now with the Improving Access to Psychological Therapies programme that's being rolled out across the country, there's more and more talking therapy, especially cognitive behaviour therapy, available really quite rapidly in more and more places in the country. Sometimes people can feel absolutely desperate when they're depressed, and they can have thoughts of harming themselves. Now, thoughts of self-harm are very common when you're depressed, but occasionally people can actually go on and make plans or start taking actions to harm themselves, to perhaps kill themselves even. And it's a good idea to plan with your doctor what you might do if you ever get those feelings. So you could, for example, write down on a piece of paper the phone numbers of the 5 people you're going to telephone if things get really bad and you feel quite desperate, because usually at least 3 of them will be out. So you need 5 numbers to make sure that you catch somebody who's in. And you could also perhaps put down on the list as well your GP's phone number and also the phone number of the Samaritans, so that if you're feeling absolutely desperate, you know what you're going to do before you get there.
My name is Emma Supple. I work in private practice in Enfield in a clinic called Supple Feet, and I also work for the NHS as a podiatrist and podiatric surgeon. I think the first thing to say about elderly feet is that sometimes it just gets harder and harder to get to your feet the more elderly you get. And we have to be mindful that people are living more on their own, especially as you get more elderly, you're more isolated sometimes. Again, you can't be dictatorial about this. So clearly, if you have someone who's elderly, can't get to your feet, then we need to bring in some extra help. So if you have someone who's elderly who needs their toenails cut, that's nothing to be frightened of. You just simply do to them what you would do to yourself. And only if the nails get thickened or involuted or ingrowing or clearly sore, then you can get a professional. More and more clinics like ourselves are doing just toenail trims because we recognise that there's a need, and charities like Age Concern are managing this social care. It's very important that when you go to your podiatrist you take a list of the medications you take, and we are very interested if you're diabetic. We need to know if you're on warfarin, we need to know what antibiotics you're taking, etc., so that we can really bring that into your care, because you'd be surprised to know that there's lots of things that manifest themselves on your feet that come about from other diseases. For instance, rheumatoid arthritis, diabetes, some of the arthritises can cause problems that we see on feet. As we get older, we do expect certain things to start happening to our feet. We know that the foot's the furthest away from your heart, and obviously your circulation has longer to get there, and the nerve pathways and things. So as we get older, we do hope and expect that you have good foot health, but we do need to be mindful that you can be a bit more vulnerable in the area. For example, chilblains. If you have a tendency to be a bit more fragile, then you're more likely to fall. If you fall, you're going to have a fracture, and that's going to impair your mobility and independence more. So that's where the multidisciplinary team starts to work with the district nurses, with the carers, with the doctors, with the physiotherapists and the podiatrists, all giving very important input into looking after the elderly and their feet. It's very important that people know that there's lots of places that they can go and get help with these simple tasks, such as cutting your toenails, washing your feet. And then obviously we have a huge problem in the country of increasing problems with Alzheimer's and dementia, and very sadly. And those individuals do need to be checked on their foot care, because more often than not their shoes and socks stay on in the doctor's surgery and no one has a look to see what's actually happening. So you really need to make sure you're getting no nasty skin infections between the toes, and the skin's being looked after, and everything is really quite comfortable and hygienic and healthy. So in summary, elderly feet are feet that you've had for a lifetime, have walked you a lifetime, and have done you an amazing service. So you need to be paying attention to them. Simple things: washing them well, moisturising them well, getting them to a podiatrist for professional help whenever they've needed. Always looking to wear insoles orthotics because they help arch supports. They're very helpful on making your feet comfortable. Making sure that your shoes you wear are suitable for the occasion, so you walk up a mountain in a pair of walking boots and you go to a dance in a pair of dance shoes. If you're unfortunate enough to start getting actual disease processes going on in your feet, the podiatry profession will be very pleased to help you and very capable of helping you. And you'd be surprised how instant the relief can be. And essentially, look after these feet. They've been looking after you, and take care of them.
Hello, I'm Dr. Rupal Shah. I'm a GP in Battersea in London at the Bridge Lane Group Practice. Fever and vomiting are common symptoms in childhood, and there are many possible causes. The most important thing to bear in mind is how well you think your child is in themselves. For example, if they're quite drowsy and floppy, if they're not eating, then there's a higher chance that they could be seriously ill with a nasty infection, and you should certainly see your GP in this case. If your child is quite well in themselves and is still eating and drinking, is still playing and interested in their environment, then there's less of a significant chance of serious illness. If your child isn't managing to tolerate any fluids, then that would be another reason to go and see your GP, because children get dehydrated quite easily. So fever and vomiting can be caused by a viral illness. If they've caught a tummy bug from nursery or from school, like a rotavirus infection, that often presents with fever and vomiting, and that's usually self-limiting. the child isn't usually very unwell in themselves in those cases. So they're quite cheerful and alert even though they are throwing up. There are more serious causes of fever and vomiting, and these range from a bladder infection all the way to meningitis. If you're worried that your child is less responsive, more floppy, not themselves, then it's always worth seeking urgent medical help.
My name is Brian Williams. I'm the Professor of Medicine at the University of Leicester and the University Hospitals of Leicester NHS Trust. So under normal circumstances, a normal blood pressure in an adult is less than 120/80. And if your blood pressure is persistently elevated, and it's the persistent elevation which is important, then it can cause damage to blood vessels, the kidneys, the heart and the brain. And that's why we're interested in detecting people with a high blood pressure. And we call the high blood pressure hypertension. About 25% or 1/4 of all adults have high blood pressure that might benefit from treatment. And once you get to the age of about 60, then about half of all adults have high blood pressure. So it's quite a common problem that gets more frequent with aging. As a doctor, I often get asked by patients, well, what causes it? Well, in about 90% or 9 out of 10 cases, we can't identify a cause. It's just that your blood pressure tracks at a slightly higher level than what would be ideal. And in most cases, we simply identify it and treat it. One of the big problems about high blood pressure is that it really doesn't cause any symptoms at all. And that creates a problem for us in medicine, because if you don't have symptoms, the only way we can detect it is by routine screening. And that is why having your blood pressure measured by your doctor is really part of the routine examination your doctor will do when he has the opportunity to see you, perhaps about another illness, or he may call you in to have a check periodically for blood pressure. The other thing I would say is that if your doctor measures your blood pressure or you measure it yourself and it's high, don't be alarmed by that, because quite often the second time or third time it's measured, the blood pressure falls to a normal value. Quite a lot of us get a slightly high blood pressure when we have our blood pressure measured for the first time. There are two approaches to treatment. The first are things that you can do yourself. We know that if you have a diet that is high in salt, for example, some people are particularly sensitive to salt and their blood pressure will rise. So a diet that has a reduced level of salt may help lower your blood pressure. Also, because blood pressure is associated with increased risk of cardiovascular disease, if you have high blood pressure, we would often recommend a number of lifestyle changes to try and reduce your blood pressure and your risk. Inevitably, we would recommend that you stop smoking if you smoke. Inevitably, we'd recommend that you try and maintain your body weight as an ideal body weight by taking some regular exercise. In terms of diet itself, we would recommend that you eat the usual vegetables and try and reduce the amount of fat in your diet, all of which will be important in reducing your overall cardiovascular risk. We have a number of medications available. Most of them need to be taken once a day. Your doctor will select the medication that is best suited to you based on your overall profile and your age, etc. Now, another question that I often get asked, when, particularly if it's a younger patient with high blood pressure, is whether or not it runs in families. Well, there is no doubt that if your parents have high blood pressure, that on average you have a slightly higher risk of developing high blood pressure. So if your mother and father have high blood pressure, make sure you get your blood pressure checked. In many cases it'll be normal, but in some cases you may have inherited some of these unknown factors that give rise to an elevation in blood pressure that appear to be genetically determined. So in terms of further advice, if you've recently had your blood pressure measured as a one-off, or you've measured it yourself at the supermarket and you found it to be a bit high, then I would say this, that if it's the first time it's been measured, it will need to have repeated measures by your doctor or the nurse in your doctor's surgery, just to find out where it levels off at and to see whether it's persistently high. If it is persistently high, as I've discussed, lifestyle changes yourself can make a major impact on your blood pressure, particularly maintaining an ideal body weight. and trying to avoid foods that contain too much salt in the diet. If that doesn't work, and it doesn't for everybody, then you may need drug treatment. But I would like to reassure you that these